welcome to TNIE Online. I'm Chetna Belgare, and here we are yet again here to talk about COVID-19 and the possibility of fourth wave in India and Karnataka. Today, we could probably look at whether our past actions has either helped us to handle the third wave better, what is the present scenario, and what do public health experts, epidemiologists, and scientists expect in the recent future. To talk to us on these issues, we have with us Dr. Giridhara Babu, renowned epidemiologist, public health expert, member of Technical Advisory Committee for COVID-19 constituted by the Government of Karnataka. We welcome you, sir.
Thank you, Ms. Chetna, for having me.
Hello, sir. Like the saying goes, even if we leave the virus doesn't seem to leave us. We are here again seeing fresh surge in COVID cases around the world. There are infections rising in UK, parts of Europe, China, South Korea, seeing largest spike in cases in more than 2 years. So with India seeing around 1,938 fresh COVID-19 cases, and Karnataka, we are looking at seeing cases as low as 80 to 100 per day and about 2 to 3 deaths. Can we officially, first of all, declare it as the end of third wave?
Okay, so I think, thank you for having me on your show again. In terms of understanding end of the pandemic or the end of the third wave, we need to avoid some of the confusing terms. For example, end of third wave, does it mean that we don't have to worry about COVID-19 in the future? Does COVID-19 similarly to flu pandemics or epidemics, does it behave similar to the flu virus? And very often there is use of term endemic. So I just want to make a few issues here to clarify. End of wave or end of the pandemic or even endemic does not mean the end of the virus. The virus is here to stay. The virus will probably find ways to replicate and sustain its own life cycle. So while it is doing that, whether it is infectious or virulent to human beings is what is important to us for our survival question. So very often the end and endemic are used synonymously. That's not correct, right? So even if it becomes endemic, it does not mean that it will stop being harmful or more infectious to human beings. For example, if you look at flu, each time there are flu seasons, there are deaths associated with flu. If you compare to tuberculosis, malaria, which are endemic diseases, the deaths are far higher than COVID-19. So endemic does not mean that it is a good thing, and endemic in no way means it's going to be an end. And end of third wave by no means that there will be no future waves. So from that perspective, we need to look ahead regarding the COVID-19 situation.
Okay, so that's very clear that there is no end for the virus to remain. It is going to stay here. So that said, there is an interesting study by IIT Kanpur which says that the fourth wave in India is expected sometime around June, and it will peak sometime in August, September per se. So what is actually the status? I mean, this is based on the Zimbabwe data, and there have been both arguments. There have been multiple, even you people have commented from the Technical Advisory Committee where you have analyzed the situation. So what is the possibility of another wave, or how do we look at this particular study and the possibility of a wave now?
Okay, I'll answer both. Initially about the study itself. I don't think it's fair to compare India's scenario with Zimbabwe's scenario as the model suggests. Even within India, it's completely heterogeneous. Within states, if you look at just look at Karnataka's example, more than 50% of the cases come from Bangalore. So can we take rural Karnataka as the prototype for Bangalore? Even within a state, the model will not hold good if we are going to base our models on a particular homogeneous assumption. And also the way they have estimated, it has some limitations. But I would agree with them in one possibility that we will have future waves. There is no doubt. The timing depends on several things, which I'll explain in a minute. But we can't reliably forecast the next wave without understanding clear data inputs from several parameters. Which are those parameters? I look at them as three constituents. One is agent, which is the virus itself. Next is the host, which we as human beings. And the third is environment. In terms of the virus or the agent factor, the virus is capable of evolving much faster. And if there are more infectious variants or more virulent variants, we will be in for surprise. If you recollect, after the first wave, people said India will not have any more waves. We have reached herd immunity. After the second wave, they said we have hybrid immunity, which means we have both from the infection and from the vaccination. Therefore, there will be no next wave, and we have reached herd immunity. And then there was third wave, which was due to Omicron. So I think we should not get caught up with the narrative because the agent itself is changing. So the herd immunity is with the assumption that the virus is stable. So that's no longer true. Regarding host, the immunity, the antibodies, it has been documented very well now that beyond 3 to 6 months, the antibodies will not sustain. Is that a good thing or bad thing, or should you have antibodies forever? No disease will be able to sustain antibodies forever, but there is immunological memory. Will that be sufficient to mount a response when the virus presents next time? So that we need to understand completely. Finally, environment is COVID appropriate behavior. So a combination of these three will determine when the next wave will be. To summarize, if the virus changes faster, or if the antibodies are not effective for a longer time, or if the environmental factors promote spread of the virus faster, a combination of these three will get us the wave earlier or later, depending on how these three are in that particular region in the world.
Okay, so there is this pattern which is being noticed that a few months after US sees a surge, then India also follows. Is there any such pattern actually? Does that exist? I mean, will we have that kind of a thing? Is there any prediction or anything done on that basis?
These are all ecological comparisons. US officially will have a fifth wave, and then the sixth wave if there is another wave beyond that. There are 5 to 6 waves in many countries in the Europe, and generally each country had 3 waves at least. So it's not fair to compare India with the US. Each country is a comparison by itself. So, for example, in every country, there are waves between 3 to 4 months. If that's the pattern, then for India, we have had the similar pattern. So we should be careful around that. And these cyclical patterns are known for every infectious disease.
So is there any clarity per se so far about which variant is driving the waves in other countries? I mean, is it Deltacron, a combination variant with Omicron and Delta, or is it a new variant altogether? Because it seems to be behaving differently in each regions, right? So, and there are a lot of these sublineages, which is BA1, BA2 combination. Then there is this Delta Omicron combination. There is some other sublineages. So what exactly is it? Any scientific data on that or anything being told on that?
First, there's no uniformity in getting the genomic sequencing data from every country. Although whatever is available, it is predominantly from UK, some European countries, and the US. Of course, India is doing of late really well in genomic sequencing, at least to understand which variant is driving the wave. So BA1, BA2, as you suggested, are the predominant ones. There is also the combination of Delta and Omicron in some parts. And there are recent reports which suggest even at the genomic sequencing level, when they have looked at these genetic sequencing results, show that virus is capable of showing the new evolution forms much faster by adopting to both Delta and Omicron. So if you see what happened between Delta and Omicron, the current version of the virus does not enter the lungs. It is predominantly in the upper respiratory tract infection. That gives it a survival advantage. So will the next version give more advantage in terms of survival, or is it going to be more virulent? We really don't know. So it's too early to predict.
But it is possible that a combination variant can also turn into a stronger one altogether. Can that happen? It can mutate into another one. Can you just explain this whole theory about this recombinant variant, what we're talking about?
Basically, we look at how the flu, each year we have a updated flu vaccine to see the kind of changes that occurs in the flu virus. Similarly, for SARS-CoV-2, the virus has to survive. How can it survive? If it makes the human, who is the host, to die, then that is the end of the virus also. So the virus wouldn't want that. I mean, because you're asking me to explain simply,
Yes.
this is the easiest explanation
Yes.
I can give. So if the virus has to survive, then the human beings have to survive. If you look from Delta to Omicron, that's the change that happened. So instead of being more virulent, by being more infectious, which means it spreads faster, it affects more human beings. Therefore, there are higher chances of the host environment for the virus to replicate, and that's the best version that the virus could find. So many people who are hopeful, they think that this is the last version. After this, there's no more change. Similar explanations were given even after the Delta, variant. I I'm neither on this side or that side, because as an epidemiologist, you have to be unbiased and then see. We don't know how the virus will evolve. So why not look at the data and then see if there is an evolution of the virus, which will reflect in terms of whether it's more infectious or more virulent. And that's what makes us understand the transmission dynamics for the next wave. So currently, we can keep all the options open, but it might be over optimistic to think that we'll not have more virulent or more infectious virus, or it might be underestimating the virus if we think it is not capable of doing anything further. So I think we need to be cautiously optimistic.
So as of now, at least in India, we don't have to panic per se. And I think we've handled 3 waves, and we've done our vaccinations well. So looks like we have some kind of following COVID appropriate behavior is definitely the thing. Wearing of your masks and social distancing cannot go. I think so far people, including me, have understood that much. I just want to know what can we do in terms of preparedness now, because we've been hearing, even Union Health Minister talk about surveillance, monitoring, and wastewater monitoring. There's a lot of things which are being talked about, but is it feasible? One, are we doing it? Is another one. Because most of them seem to be tired, and even public seem to be fed up of this, and everybody is back to business types. So what's the way forward now?
If back to business means ignoring one's own health, which is unfortunately the norm. So you look at the family, if people save for education or in terms of housing or other needs, but do we actually save money for health? Starting from the level of family, if you think how we prioritize health, it's not really on the top among the priorities. So therefore, back to business should not mean ignoring health as a priority. Having said that, India has done tremendously well from the beginning. I've been saying this, and I've been flagged for saying this, at least by the international experts. But you look at all the predictions so far about India. There were doomsday predictions right in the beginning of the first wave saying India will have, of course, there is gross underestimation of deaths, but that's true for every country. But otherwise, in terms of the short duration within which the entire response was mounted throughout the country is phenomenal. I don't think this kind of transformational changes during a short span of time in the health sector has not been seen in many countries, including India, for a very long time. So I think we have done well. But that's no reason for complacency. We can't say that we have done well, therefore nothing can affect us in the future. And that's the lesson we learned from the Delta in terms of the second wave. So we need to be careful as we move ahead. So you asked about surveillance. How do we move ahead? Surveillance is not necessary only for COVID-19. Surveillance is the intelligence required to know where diseases flourish so that you can prevent them, you can control them. And this is required for a whole range of diseases. And by doing that, we can prevent a future pandemic like COVID-19. So surveillance is needed because people have to be healthier and they should not get affected like they got affected during COVID-19. So surveillance has nothing to do with what people do. This is the function of health system that will continue. The other question you asked was about what should people do? Whatever the appropriate behavior has been recommended by the government, if people follow, then that's sufficient. But if that itself is probably looked at as a suspicion in terms of whether we should be wearing masks or not, what about crowds, why should we follow? This is a completely different discourse by itself. We have seen all these waves, and we know why India has done well compared to the other countries. Now, going back to business, if that means float all the norms and then be careless, is not the way ahead. So I think even if you look at the government's approach, they said whole of society approach. Without society's support, a government's programs alone cannot be successful on their own. So therefore, this is the time for synergy in terms of coordination.
I just want to understand one bit which we have not spoken about, the vaccination per se, where there are boosters, precautionary doses which are being given now, and we also have vaccination for children which has come up now. So and there is talk about the children from even below 12 years that we should start giving. I mean, it will come soon. So do you think this will help us? Or there are two things. One is the children vaccination and the other one is the precautionary dose for everybody, for all adults above 18 years.
So now booster doses or precautionary doses, however we call it, are absolutely necessary for people with high risk conditions, including elderly, comorbidities, and immunocompromised conditions. And the data suggests that the booster dose for everybody will definitely help in reducing or at least in ensuring that the antibodies are present, because that's how the effectiveness is seen. So therefore, booster doses will remain as a constant feature of COVID-19 control all over the world. But without covering the two primary doses in some part of the world, having as many boosters in any country is not going to help the situation. So this has to change. Which means that we have to take collective global responsibility for making sure every area gets the vaccination coverage done. Only then boosters in specific regions will be meaningful. Otherwise, we are allowing variants to develop in one region, and in another region we are flooding with boosters. So that's not going to help. Regarding children, there is considerable debate over children need or not, especially within India. But if you look at the developed countries, there has been already FDA approval and CDC agreeing for children 12 years and above. Then the next age group was 7 years and above. So there is progressive reduction in the age group for which children are targeted for vaccination. Whether they require or not, currently we have gone through only for 2 to 3 years. This is not sufficient period to know how this virus is going to affect in the long term. So for example, the reason I say that is, yes, children are not affected when there is COVID-19, but is it only a short-term thing, or in the long term, are there going to be any adverse consequences in the long run, what we call as long COVID? Because they have fewer ACE2 inhibitors, Does it also means that there is no other immunological changes in the long run? We simply don't know yet. So does vaccination offer advantage over this long COVID? Again, that we are not sure as of now. So you look at both in terms of a prevention strategy and cost-effective strategy. And if that is reasonable to give it to children, we should go ahead with the policy of whichever age group is eligible and then get all of them within that age group vaccinated. So if you ask me, 7 years and above, if there is an effective vaccine, should we give? Yes, we should give. So that's my understanding.
From COVID, we were slowly moving towards looking into other non-COVID diseases also. We were kind of focusing on that. And unfortunately, now I think we've come back to COVID and there is this back and forth thing. But how do we ensure that there is this whole One Health thing, and how do we move ahead in that direction? Because COVID is not just one thing, right? There is a lot of other things which are being neglected completely, and we are seeing that repercussions in many of our data which are recently being released. So could you throw some light on that?
Yeah, thank you. I think this is a great question. So COVID-19 is a reminder for us that in the days to come in future, more than 80% of all the future disease outbreaks are going to be zoonotic in nature, which means we need to be looking at the animal-human interface. So One Health, as you said, is governing the spheres of animal health, human health, and environmental health. We can't forget about these interfaces and not pay attention to. We can't say we have so prioritized human diseases. Where is the time? Where is the resources? That's not the way for neglecting the other aspects of One Health. This is the time to start tracking the diseases which can spread in human beings from animals, and how the environmental aspects are going to be regulated. So Bangalore, for example, in BBMP has done BBMP One Health task group, and there are several agencies who are involved actively in ensuring Bangalore has a One Health plan. This is a good step forward. So even at the Government of India level on One Health, there has been focus both by Department of Biotechnology and Department of Science and Technology. So therefore, in the days to come, we should not be surprised when the next outbreak occurs because of this zoonotic disease. We should have clear surveillance platforms, strengthening of the laboratories, and ensuring that we are tracking both diseases in the animals and humans, so that we are not caught by surprise, but we act proactively.
Thank you so much for your time. I know you're a very busy person, and thanks a lot for talking to us. That is all we have for now. Thank you for watching.
Thank you.